Welcome, everybody, to this episode of the Mind, Body, and Beyond podcast. And with me today, I have Dr. Dan Hulsey, also known as Dr. Dan to all of those who come into this office and know him in this chiropractic setting.
Absolutely.
Thank you for being with me.
Thank you for having me.
All right, awesome. So as those of you who have been with us before on the Mind, Body, and Beyond podcast, we talk about the mind, the body, and then the beyond. And the beyond is those things that we can't always quantify. We can't always explain. They're a little bit out there. They're beyond our scope of understanding sometimes. Now, what I love about what we're going to talk about today is that there is a scope of understanding
100%.
and there is quantifiable evidence that can show you exactly how your body is shifting and changing through this process of the Atlas realignment. So would you mind, first of all, sharing with us a little bit about your background, how you got into this, and then maybe go into a little bit of what this process and procedure is?
Yeah, absolutely. I never had any intentions of being a doctor. And so this was not a path I thought I was going to go down, but it was a path I needed to go down. I had a lot of sporting injuries growing up as a kid. I played football, wrestled, played baseball. And really, for me, it was the traumas in the military that were the catalyst. And I've learned now, looking back, I was vulnerable from the injuries I had as a child. And so the injuries that I had experienced in Afghanistan just exacerbated some of those vulnerabilities that were already there. I went through the traditional medical model and I saw chiropractors, I saw MDs, I saw physical therapists, and no one seemed to be able to get to the root of what was the true cause of all these asymmetries and the compensations and the dysfunction. And luckily, my dad, he had found this doctor, Dr. Stan Pierce Jr. over in Clearwater. He's actually the one that developed this table and took this technique and progressed it from, the origins of upper cervical chiropractic. He had migraines for 30 years, and this doctor told him, you might only need one adjustment. And he was honestly kind of pissed off because he had been to chiropractors for 20, 30 years. And he was one of those that received a manual adjustment to the neck a few times a week to keep the headaches and migraines at bay. But if he stopped going, he was going to go down a landslide. And so he went over to Clearwater, went through this process, and it's been 9 years now, and he has not had a migraine. And for him, it was life-changing. And so someone that, like myself, I had headaches 4 to 5 times a week. I wouldn't say migraines, but just a headache that would start in the neck, grip up the top of the head, and by 6, 7 p.m., it was just a strangle on me. And again, I was seeing a traditional chiropractor, and things were better, but if I stopped going, that was it. And I couldn't afford the model that was 3 times a week for months on end with a chiropractor. I needed a solution. And what we had found through this technology with Dr. Stan Pierce, the EPIC technique, was your body heals from holding alignment, maintaining neurological balance, brain-body connection. You don't heal from getting constantly twisted and cracked.
Right.
So the question is, okay, how do you get someone to hold an adjustment? It just comes down to accuracy and precision. When you're using your hands to feel, palpate, twist, spin, crack at a certain angle with a certain amount of force, there's a lot of variables. When you're using a piece of machinery like this, you can control all those variables. We know down to the 100th of a degree how your bones and joints have misaligned. We know how they've developed through your epigenetics. We're going to pre-program your custom coordinates into this machine, control the exact vectors that are needed. Now when you receive that adjustment, you hold one adjustment anywhere from 6 months to 2 years. Think about that from an exponential healing process. So for me, when I saw my dad's results and then went down and experienced this for myself, it was like magical. The initial experience was strange because, you get a sound wave, you're wearing this neck collar and you don't really feel the procedure, but you start to feel the healing the days after. And I woke up very stiff and sore and was like, man, something happened. But I didn't get a headache that day in the afternoon. And every day around 4 or 5 p.m., headache would creep up. No headache. I'm like, it's a fluke, it's placebo, So
Right.
I wait and it's been 3, 4 weeks. No headache. We start sending down friends and family for vertigo, Meniere's disease, sciatica, numbness and tingling in the fingers, disc herniations in the low back, and every family member, whether they flew from Cali, drove from Michigan, they would have the same report. Oh my gosh, my Atlas was out and now those problems are gone. When you go to the root in Atlas, because it protects brainstem, you're getting to the source of a lot of the body's dysfunction. So heal it at the source the body has a really good ability to heal without needing constant visits. And so for me, once I felt and experienced it and then saw the proof over and over again, I didn't feel like I had any other path. I wanted to give people that gift. I wanted them to be able to get their health back the way that I got my life back. And it became a no-brainer. I quit my job. I had broke up with a girlfriend at the time and fully went into doing pre-med, prereqs. And that was 7 years ago with the intention of opening up this clinic to serve the people by identifying misalignments at Atlas.
Well, it's funny. So for those of you watching, I met Dan's dad, because his dad helps out here in the office sometimes.
Family office.
And what was really cool was your dad was telling me his story, and he was saying that you took a bit of a non-traditional route too in school, where you were doing 2 programs at the same time, like really just moving and grooving. I was going to use a different terminology, but I decided
they don't teach this type of advanced technology within the schools, unfortunately. There are a couple clubs that are dabbling in it, and whether it's political with the schools, I'm not sure the reason. It's difficult. It's a lot more math. It's a lot of a deeper understanding. And think about it. That cranial cervical junction there where we're working, it protects brainstem. It regulates vagus nerve. Mm-hmm. It is controlling the amount of oxygenated blood going to the head. It controls the drainage of the dirty metabolic waste that's supposed to be draining the head. It controls the symmetry of the entire this is our control center. I always will tell patients, your atlas bone and brainstem is kind of like the UPS center of your body. Brain is sending signals to brainstem. Brainstem is responsible for organizing them and sending them to the different regions of the body. If there's dysfunction here where brain is attempting to communicate with body, of course there's going to be dysfunction. And it goes back to the simple thought, why do they teach anatomy and physiology together? Anatomy is the structure.
Sure.
Physiology is the function. When you lose the structure, let's say, for example, a pancreas starts losing the shape, malforming, you're going to have functional issues with those alpha, beta, the glucose cells, right?
Sure.
But you start fixing the shape of that structure, function starts to return. It's no different with the spine. The muscles are controlled by the nerves. Well, what protects the nerves? The alignment of the bones. Fix the structure, function improves.
And so for those of you who may not know, and there'll be more videos and little pictures that you'll be able to see later in the show, but it's basically the bone at the base of the skull where
you got
everything is hanging out right there. Your skull is on that. There's movement there. There's nerves running through there. It's a very
intricate region. It's more vulnerable than most. And again, I know you'll show with the pictures later, but a weird fact about Atlas is there are no discs above or below that bone. There are no joints that hold it in place. Every other vertebrae in the spine has a disc above or below, helps keep it stable.
Right.
Atlas doesn't have that, which makes sense why we have more range of motion at that area, but it also makes sense why we're more vulnerable to misalignment at that area.
And so what I think is also interesting is that has this ripple effect. So I have a list of some of the areas of the body that can be treated by adjusting that.
Please, yeah.
So allergies, asthma, concussions, depression, fibromyalgia, high blood pressure, headaches, low back pain, which people might be like, what? Seizure disorders, sleep disorders, stress, neuralgia, which is this kind of nerve pain for people who don't know what that is, vertigo, and then also we've got this digestive issues. That's another big piece of it too. So to name a few of the areas that it can support. So I have 2 questions for you. One, you're adjusting the Atlas. Okay, so for those that are used to more of a traditional chiropractic approach, can you still go and have your traditional chiropractic approach just as long as people don't mess with the neck, because then it will throw off exactly what you came here
100%.
for?
We co-manage with so many doctors, not only here in the state of Florida, but also across the country. We've had patients that have traveled from 6 different continents to receive care here now.
So cool.
Very cool to see.
Yeah.
So absolutely, when they go back to wherever they're at, we find them another doctor that either understands our procedures or respects the patient wishes. Mm-hmm. And yeah, we don't want them doing any manual adjustments to the cervical spine, but there still are a lot of other bones in the body. So as long as Atlas is holding and maintaining and those neurological indicators are clear, 100%. Do manual therapy work, make secondary adjustments on the rest of the spine. Please give them a rehab plan. Atlas is the starting point, but it can make a huge move for someone and save them a lot of time and efficiency with their healing.
Well, and I also, you spoke about headaches specifically, and I think that for many people, at least the ones that I've talked to, and myself included, I do notice there have been times when headaches would emanate from my neck or the base of my head and work their way up. Also, I could feel this pain behind the optic nerve, and there would be pressure or a little bit more blurry vision, something like that, and then it would dissipate, kind of go away. So would you say with this adjustment that can also address some of those, the pressure and everything that's happening in the head itself?
Well, and when you go back to the atlas bone, one of the structures I didn't mention that it absolutely has a close correlation with is the vertebral artery. Vertebral artery is the main blood supply that is feeding all the cranial nerves that sit on the brainstem.
And so that would be in the back of where is that artery in the back of your neck?
It actually feeds directly through the wings of the atlas transverse process. So if that atlas bone is rotated, you can theorize and see the kink that would be in that hose, so to speak. Of course, like you said, blood pressure is going to rise because you're cutting off blood supply trying to get to the brain.
Yeah.
So absolutely.
And just one thing I also want people to know is that this is not it's not a long drawn out thing. It's you come in, have some, kind of an assessment, x-rays. I'll be showing you some examples of this in the video shortly. And then laying on this table, Dr. Dan adjusts everything, makes sure it's set up, goes over what's happening. And the procedure literally takes a second. Yep. I mean, it's
about a total of 2-hour process with lots of questions, otherwise about an hour and a half. But between that, we always start with the neurological evaluation because we're not just doing this procedure for anyone who walks in. We want to ensure that they are a candidate for this care and they do have neurological indicators that fall within the parameters of the research that Dr. Stan Jr. and them have done.
Okay.
They have published studies with Harvard Medical and the orthopedic journals. So as long as you have a technique that's evidence-based and the doctors are trained 100% proficient in that process, that's what allows us to get those duplicatable results. If it's an Atlas client, we can help.
Yeah. And, like Dr. Dan said, he has a map outside in the hallway, which I think we have some footage of too, where it shows where around the globe where people have come in to be treated, to find some support, to have that change in their life that they're looking 100%. For almost miraculously.
There's 8 of these tables in the entire world, to put it in perspective.
And funny enough, I think there's 3 in Florida.
Correct.
Yeah.
Yeah, there's one in Clearwater, there's one in Palm Harbor, Florida, there's one in Melbourne, Florida, and then obviously ours here in Pompano Beach.
Yeah, that's pretty funny. So, okay, so I'm going to share a little bit about my experience that I had. So when I came in last week, we went through the whole shebang. And, I left, I had the collar on, and I was very nervous about screwing something up. So very conscious, very aware, left it on a little extra time because I was like, I'm not taking any chances. And then what I noticed was that my neck often would feel stiff and sore before.
Yeah.
I had that again. So stiffness and soreness. So
especially the first about 3 to 5 days, there's always going to be that remolding, rebalancing period. Muscles that are loose have to tighten. Muscles that are tight have to loosen. We always tell patients and expect, hey, there's going to be some soreness, and most of them feel like they're on a little bit of a roller coaster.
Yeah.
A couple really good days, like, oh my goodness, this is great. A couple days after, I'm not sure if this is even working anymore, and the body is attempting to find that balance.
I was concerned that maybe I had slept wrong or I had done something weird. So I'll be very curious to see kind of where I am. Did it stay?
Absolutely.
Put?
That's what we're going to be checking.
And so what I did notice that a few things I thought were interesting. One was, yes, I felt the soreness in my neck, very similar to what I experienced prior. That wasn't a big surprise. What I did notice was a lot of tightness in the front of my neck, right here. And I also felt like my lymph system was clogged. I so wanted to massage everything.
Oh, yeah.
I did do a little bit of tapping on my neck. Nothing,
no problem.
Nothing, a little bit of this just to kind of get things moving a little here. Nothing too intense.
Yeah.
But my body was just like, girl, come on, you gotta help us out here.
Yeah.
And then the other thing I noticed was jaw tightness, stiffness. That's another area of sensitivity for me. And then
it's interesting, all the areas that you had, selected in your file and things that you have issues, that's where you're feeling all the soreness. That's where the changes are being made.
Yes. Yeah, that's a great point. And then the other thing that I noticed that I thought was, well, it was interesting to me. I did have a couple of small headaches, but I thought that could just be par for the course with this, just everything settling in. What I did notice was some pain in my back on the right side, which was the opposite of the side you worked on. So to me, that somewhat made sense. But then I had some sciatic pain that I was a little like, what is this about? You know, obviously I know that there's connection points, but I had not had any of that. And when I would rub on the area, like this is the first time I was able to actually access the spot of where it seemed to originate from. Before I would just press and try to find it. It's like, where is it? Where is it?
Yeah.
And this time I was able to get it, do a little massage, hold it, like a little bit of pressure point work there to see if I could get it to dissipate. And it would a little bit. Today it's not really bothering me, but a couple of days of that.
Yep.
So, you know, as far as my overall experience, I definitely felt something was going on.
Changing. Which is cool because we haven't even touched the rest of the body. It's just been a sound wave to the neck.
To the neck. And it literally was just such a quick, oh, that's it. It's done. It's over. And
that's it.
Yeah. So that's been my experience.
Cool.
I'm really, you know, can't wait to see the before and afters of the pictures that you take and just see where I am. And like I said, there was one night, I'll share this one other thing too. There was one night when I was laying on my side and I had my pillow in a way that was very supported. And I lifted, my head was like this way and I lifted up and I felt like and I was like, oh gosh, did I do something? I don't know if I did. It may have just been my neck cracking and, you know, whatever, but it was enough to just startle me a little bit. So I would say that's the only thing where I had this question in the back of my mind, like, did I do something that might have thrown it off, which I think is good to know coming in a week later, because then there's more awareness of, okay, that's something to be really careful about.
Absolutely. And which is why we implore people, please come back for the follow-ups. We have to that's the starting point.
Yeah.
For us to be able to know that you're still neurologically clear. And now it allows us to say, okay, Atlas is holding great. Flip her over. Now let's work through some of these secondaries that have come to light.
Right. Exactly.
100%.
Exactly. All right. So let's get to the next part of the process and share the films.
So you'll find that we're very peculiar with how we take the films because we want to ensure we're removing all rotation and any other aberrancies so that when the software is analyzing you, it's giving us the best ability to see what your neutral is.
Okay.
Head down just a little bit right there. Good. Hold still just like that.
Okay.
You hold still. Good. Now you can spin. I'm going to have you face the x-ray machine here, and then you're going to have your back to the board.
Do you want to step out, babe? Or are you good?
Yeah, go ahead, yeah.
No. So it's digital x-ray, so there is no even like scatter over here.
Oh, there's nothing.
They also told us that we didn't even have to have a lead shield for this, and we're like, we're still going to buy one, but the reps were like, it's not needed, it's digital.
Oh, interesting.
It's 1/3 the amount of normal radiation than like a typical x-ray machine.
Yeah, okay.
I've had patients where we've had to literally like, they had issues and we were like in here like holding them while another doc took the films, or we've had people in wheelchair. I mean, we've gotten creative in here. So if you want to look at this now, just to see what I'm doing here. So once we capture this first image, now what I do is I run this through our software. It will analyze your bone structure and then it gives me the next angles that I need to be able to take the subsequent films. All the other upper cervical docs, they take this based on just a straight 10 degrees for every patient. That's assuming that your atlas bone is actually sitting at 10 degrees. We take the first view at a baseline of 0, analyze your anatomy, get the exact angle of what you are, and then we use the digital inclinometer. If you need 31, that's what we do. If you need 17, that's what we do. And now the x-rays are custom to your anatomy.
Oh, I see. Okay.
So
Interesting.
We'll go here. And we'll measure that atlas and we'll start actually seeing what needs to happen. And see, yours is double. You need 20 degrees. Could maybe argue 18.4.
So what is that when you say, which direction is that moving?
So it's nothing that gives any kind of clinical relevance. What it does is it just tells me the angles to catch the plane line of exactly how your bone is sitting.
Okay.
The average is 10 degrees. Yours is sitting at negative 18.4. So it just tells me that we have to capture it from a different angle.
Okay.
To ensure that we're capturing the anatomy that we're after.
Gotcha. But that doesn't really have anything to do with like the refinement or recalibration. I'm probably not using the right terminology of where the bones.
That plane that we're measuring right now, that plane won't change. That's the plane of your atlas and how your atlas bears the weight of the skull above it.
Oh, okay.
So it's just for me to capture the right plane line of your bone structure so that when the software analyzes it, when I go back to the other room, it gives me all the data needed to be able to input it into the sound wave.
So that's not changing. It's just so that you can actually see when you're going.
Gain correct measurement. It's more specificity.
Gotcha. Okay.
You got it. All right. We're going to come back to her now. So you just scoot back in the chair just a little bit. You can slide back. It has some wheels.
Okay.
There you go.
Oh, just too far. Is that too far?
Perfect. And you just stay very neutral and straight there. I'm going to have the lights come back on. Watch your eyes if you'd like. And then we dial this in to 18.4. Mid-bridge. I'm going to check to make sure that's going right over Atlas. It is. Good. I'm going to bring your head down just a little bit right there.
Okay.
Just look through me like I'm not even here, okay? Hold still just like that.
Okay.
Hold still. Good. Keep holding still. I'm going to turn the lights off for a moment. Let me just make sure I got what I need here. One. Could not have been any better. Love that.
Nice.
Perfect. Let's check out the next one. So hold still here. All right, this one's a little bit weirder. What we're gonna do here, you're gonna look straight forward, and you're gonna open the mouth as wide as you can. It gets the teeth out of the way.
Okay.
So go ahead and hold just like that. This allows me to see the bones behind the teeth. Good, hold still just like that. Don't move. You can relax.
That is weird.
Yep. I had a lady from Boca a couple months ago with, what was she, like low 80s maybe? And I said, all right, ma'am, like you open your mouth for me, get the teeth out of the way. She's like, no problem, honey. And she just hacked out her uppers and her lowers into her hand. And I'm like, okay, that solves the problem.
That's one way to do it.
They are out of the way. Okay, very good. Those are both great. Last one here, another strange one. Spin around, and I would like you to face the board.
Okay.
What we're going to do here is I'm going to tilt this board at an angle, and we're going to get a bird's eye view of how that atlas has shifted underneath the skull at that level of brainstem.
Okay.
So you're going to scoot in halfway for me, right about there.
Is that halfway?
Perfect, yep. And now from this position, I want you just to look up. Good. I'm going to rotate you real quick. Keep holding yourself up. Good. Now, while looking up, bend forward at the waist, and then let that chin extend down until you hit the board with it. Perfect. Lid still right there for me. Okay. Perfect. Hold still. Good. You can sit normal and relax now. Let me make sure that I got what I need there.
Okay.
So we take all these different images in 2D, which is what gives me like a 3D composite when we use the software to try to fully understand how those bones have shifted.
And so, okay, so for everybody that comes in, they start with the evaluation part, which we're going to
do with Misha.
Yeah.
Correct.
And then this part of it, and then
Correct.
the
actual delivering of the sound wave correction, and then coming back to do post films as soon as we're done.
Okay.
So the process for you today is I'm about to go study these for the next 15 minutes, and we're going to gather all the data.
Okay.
Once I have the data, I'll meet you in the sound wave room. We review everything together, and we make sure that what I found in the exam 2.5 months ago is what I'm finding here on the x-ray. We input that data into the sound wave machine, deliver the correction.
Okay.
That same exam that we did in the sound wave or in the consult room the very first time, we'll do a mini version of that. So I'll get a baseline right before we deliver the correction. I'll check your legs, I'll check your low back, we'll check the arm strength, we'll check the nerve, and then I deliver the correction. As soon as we're done with that, I'll let you rest for 3 or 5 minutes. I come back in, I recheck that same mini exam. Everything should change right away. The leg that is short should be level. The back that is spasming on only one side will start to let go. The arm where you have weakness will be strong all of a sudden. Remember in the exam though, you had to change the position of your neck to give that result last time.
Yeah.
This time, after the correction, your neck will be neutral, but all those things will change. You will not need to have to move the head to open up that nervous system energy, the communication, if you will.
Yeah.
Remember, Atlas is what controls that nerve control center. It regulates it.
Right.
It sits right there at the brainstem with C1 and C2.
Okay.
So it's not only a vagus nerve involvement on the nervous system side of the coin. Carotid artery is right there, which is responsible for feeding all the oxygenated blood to the different hemispheres. The jugular vein is draining all the dirty deoxygenated blood. They all rest and sit right on the front of Atlas. And that's not talking about the neurological side where this controls the amount of electricity that's going down both sides of the paraspinal muscles, which is why most clients that come in with an Atlas problem, they have a little bit of low back pain. They got neck pain or stiffness, and they feel it like, man, it's just like on one side, or I feel like I'm being pulled.
Yeah.
The muscles are literally receiving too much electricity. Does that make sense?
Yeah, and what I find really interesting is that this procedure can impact the body in more ways than what we're talking about here. It's
100%.
like I was shocked when I looked at all of the different physiological conditions that it supports.
Yeah. Well, and here's why. It's you're adjusting the bone that protects brainstem. Brainstem controls and regulates all systems.
Everything.
So if you can go to the source, you're saving a whole bunch of time and money because not having to try to have a new playbook for every issue that's under the sun.
Right. Yeah.
And that's where I think most chiros miss the boat. I think that they don't do it maliciously, and they are doing great work. One, they don't have access to the technology we do. There's 8 of these tables in the entire world, so I get it. With that said, for us, it's about order of operations. If you have the ability to clear it at the source first and get that to stay accurately, now you have compounded healing months on end from holding. The lady I had this morning, she's a doc in Boca. I haven't seen her in 7 months. Still holding her alignment, came in, checked in. She was playing pickleball this weekend and feeling weird. Atlas is still holding. It was good. So we did some tune-up and some cleanup stuff.
She was good to go.
Left happy, good to go. I'll see you in 3 months. Come back and check in just to ensure you're still holding and maintaining alignment.
Right.
The old guy, she was going twice a week, and if she stopped going, it stopped.
Yeah.
You don't have the same level of accuracy with a percussive sound wave where you can control all the variables. Like if you're using your hand, you can't, no one's a robot. Not to mention, I don't have x-ray vision. I don't know what's going on inside there. Yes, you can feel and get an idea for it, but okay, it's a little out to the left. Perfect, let's spin it that way. So get relief, but it won't stay.
So would you say that's the same thing with NUCA, which is a similar process to this, but it's, I had that.
NUCA is way better than a traditional spin and crack because they're at least doing an in-depth analysis like this, where I would argue philosophy or technique-wise is the fact that in NUCA, their whole idea is trying to make themselves a robot and get into the right angle. I don't think it's as easy to control those variables as it is for me just to set a machine at your number and lock it in place. Yeah. I know for sure that's the vector that you're receiving a correction on.
Right.
It's also the difference why this correction holds anywhere from 6 months to 2 years. And from what I've experienced, from what patients have told me with NUCA, some of them are receiving an adjustment once a week or once every 2 weeks. So it just is a different goal, different business model for the clinic. We like operating like a pseudo dentist office. I see a patient, we keep a close eye on them for about 4 weeks. I might see them once a week for 4 weeks to get ahead of it. Sometimes it's not needed, which is why we don't sell a treatment plan, because why am I going to sell someone maybe 2 visits if you only need 4?
Right.
And I don't know yet. We're going to see how the body unfolds and how things start to progress. But we should be used as a guide, not, shit, if I don't see Dr. Dan, I'm going to feel like crap today. Like, it shouldn't be like that.
Well, and I having experienced NUCA already, I know that does require more visits, and that could be a business model thing, like you said, or it could be just the nature of that particular type.
Yep. And I think it's a combination of both. They're trained in a certain way to start that business, and they build the business typically off of the strengths and weaknesses of the technique.
Yeah. Well, and I do know too that when, like I would go in to see him, he had this like machine that would go up and down your back, and it would show kind of the areas to highlight that needed some
like hot areas or spikes with thermography or whatnot.
And then would do the realignment or whatever, the treatment, and then would check it again and kind of see what the improvement was. And I remember looking at that, and I would even ask him about it, like, what exactly are you doing? You're looking like, here's a line that's kind of jagged, here it's a little bit smoother, it was a little bit red, now it's green or yellow. What does that exactly mean? And he was just saying, like, this just shows the rate of improvement.
Like from patterns or how they're how the body's responding with it. It's a Titron device is what they use, which is it somehow does like HRV, but also thermography, so it is reading and pulling data.
Yeah. And I guess
we don't use it because the science on it is when those have those hot spikes, it could be 5 levels above or 5 levels below. So it's not as specific as to know there's an issue right at C5. Well, that could mean C1. It could also mean T4, T3.
Well, and I think that's what I'm fascinated by and excited to experience this is because of the precision of it. And I'm really excited to see how long it holds, see how I feel
100%.
Before and after.
Yeah.
And then the other thing that's come up between when I saw you last and now is that I really didn't have issues with headaches.
Yeah.
I have had so many headaches. I think they might be stress and tension related. It could be physiological from moving and from other things that I'm really curious to see post.
Well, and you'll be able to track that one easy. Headaches are I love treating headache patients. One, because that's why I am even here today, is because my headaches were taken away from this. Now, that's not to say that if I go out with friends and have too many drinks, that can't cause a self-induced headache.
Right.
I'm not saying that.
That's a different type of headache.
But the standard every 4 or 5 p.m. headaches that I would get 5 times a week, like those aren't there anymore. And it's it's a bad position. It might be impinging on blood flow that's not letting things drain properly. There's a whole slew of what it could be, but it doesn't matter as long as we get Atlas and Brainstem right. The rest likes to start to fall into place.
Well, and that I have kind of my little laundry list of things that I'm going to be paying attention to and then report back later.
Please, yeah.
And
how we're going to do this, I've already had the office manager. She left. She's going to visit my sister and their kids today, so Dad's taking over, and he's like, I'll do my best. But
I think he was here when I was here last time too.
Yeah, because they just had the baby.
Oh, yeah.
So now it's 3 months, and they're coming back in, and they're going to see the progression. Going to go help her. My brother-in-law works for the Navy, and he's a linguist for the SEALs. So they're in Virginia Beach, and he's about to have to do an appointment, so Mom's going up to help with the kid.
Oh, that's my old stomping grounds. That's where I grew up, is that Tidewater area.
Oh, okay, yeah. No, we've definitely been through there before. Yeah. The first thing we look for is the curve of the cervical spine. It gives me an idea how long you've been dealing with dysfunction, or when maybe the first trauma was that kind of allowed you to lose the position of atlas and skull to where this cascade effect starts to begin. There's 3 degenerative cascades that occur when we lose the position of atlas, bearing the weight of a 14-pound bowling ball. When you look at it, it's like, oh, wow, that is a big skull, and it rests on a bone that weighs 3 ounces. There are no discs above and below the atlas, and there are no facet joints that hold it in place. So if you look here, all these measurements I have in between, that's measuring the disc height between every single vertebrae. If you look at the spine here, same thing. Every vertebrae has a disc above and below. Atlas has no disc above or below it. Also on the back, all these side slit joints that you see here how they almost all connect like interconnecting legs at a social function or at church. There is nothing connecting the first to second bone.
Wow.
So where typical chiropractor, traditional chiropractor does very well, facet joints are their best friend. You can move them, you can do a general thrust or shove, and then they slide back into the tracks as if you had like 4 chairs stacked, one's a little off kilter, give it a little shove, slides into the tracks.
Right.
Same idea, except for you can't use that logic on Atlas because it does not have the same anatomy. It's very different.
Right.
Which is why I find chiros struggle to allow the Atlas to hold and maintain alignment, because there's no anatomy that helps it want to stay centered. It has to be about proper weight bearing, but you have to take in the genetics into account to ensure that you're putting it where it needs to be, if you will, right? Now, your the back of these vertebrae that you see, these dashed lines, it's called George's line. That is the representation of where your bones actually are in comparison to where the curve should be. So we have lost the curve.
Yeah.
That is minimum 15 to 20 years per all the spinal degenerative research that tells us it takes 15 to 20 years to lose a curve. It does not just happen overnight.
Right.
So at a minimum, something happened 15 to 20 years ago. When you keep looking further, the second stage of that degenerative cascade is we start to lose the health of the disc. When we look at your measurements now, they should be between like 5 and 7 is like healthy disc height. So 5.3, good. 5.1, lower end, but still fine. 5.1, good. Pop down here, 2.7.
Wow.
Next one, 5.98, very healthy. So where you have a lot of your dysfunction is right here at that level of C5 and C6.
Yeah.
It's also the one that's typically most vulnerable. It's the one that is most susceptible to getting herniations. It's the one most vulnerable with whiplash type traumas. I know you had mentioned that back when you were like 12 or 13, someone stepped on your neck at like a moon bounce thing.
Exactly.
We're going to keep doing some math here and you'll find this very interesting. So it takes an additional 10 years to lose the health of the disc after you've lost the curve.
Okay.
So you add it up, right? The 20 years for the curve, another 10 years for the disc. Okay, so something happened 30-ish years ago. Okay. Yeah. The next cascade that happens after you've lost disc height is the bones will start malforming, and what they'll do is start growing these bone spurs.
Oh,
See how where you have a healthy disc, you have a very healthy vertebrae?
Right.
Healthy disc, healthy vertebrae, not healthy disc, not healthy vertebrae. The body actually starts stealing calcium from other parts of the spine to try to stabilize a region that is deemed as unstable.
So kind of like putting, like you see sometimes like in construction sites, something to like hold something.
Like the scaffolding or something, whatnot.
Yeah.
It's the same idea. The body's trying to go into a protection mode.
Okay.
To try to solidify a region that is not stable, right? That takes an additional 10 years. So when you add everything up, it puts you at around 40-ish years. Yeah. When you do the math, it's like, wow, that's about the time, plus or minus a few years for sure. Other types of motor vehicle accidents or sporting traumas could exacerbate that timeline. Yeah. We had a computer guy in here the other day. He does tech for the last 30 years. He's always looking at the computer for 6-8 hours a day. So his forward head posture is excessive. So ergonomics definitely can play a role. Sure. But when you're seeing these type of degenerative changes, it's indicative that, hey, she's been out of alignment for close to 35, 40 years just because of the degeneration that is present. Trying to understand what the incident was that caused it is honestly not important at this time, but what it does give us is a guide as to how the body's going to heal moving forward. The body heals at a rate 12 to 1 when it breaks down. There's a cool phenomenon in healing that's called retracing or biorhythms. It's kind of the science of how the body heals. Contrary to popular belief, they think that you just heal like an elevator. It doesn't work like that. It's a lot more like a stock. So if this is the symptom threshold and you're down here not feeling so great, after the correction, you're going to find yourself having a boost and you're going to be like, man, Misha, like I'm feeling better. Like this is something cool is happening. And then a couple days later, you're going to take a little dip. And you're going to be like, shoot, I don't even know if this is working anymore. I was feeling really good. I'm kind of having some weird pains, but like they're different. So I'm just like confused. And then 2-3 days later, because you're still holding and maintaining the alignment, starts healing again. Right. And then once you make it through those first 2 to 3 weeks of the body remolding and rebalancing, because remember, we're going to change the position of Atlas today. The muscles take a few weeks to catch up. Sure. Now they're going to be receiving 50% stimulus on each side versus call it 70-30, whatever it was when we were palpating and feeling before, that one side does have more tonicity than the other side as far as the muscles are concerned. Those take a little bit to balance out. Muscles that are tight have to loosen. Muscles that are loose have to tighten. So there will be some remolding, rebalancing. Most patients tell me for the first week, they're just really confused. They do feel good, but they feel different. They still feel some pains. They feel some new pains. Maybe a random knee pain, maybe a random hip pain. The whole system is going to shift. And so be very patient with yourself as you're going through those first couple of weeks of remolding. I always joke with patients that the hardest part of my job is the first 2 to 3 weeks of a new patient's care, at least if they're not familiar with upper cervical work or familiar with the changes. Also, this is a percussive sound wave, so you're not going to feel anything when the sound wave is emitted. Okay. With that said, you are going to feel the healing. And so it's very synonymous to surgery from the standpoint of you don't feel the procedure, but the next 1 to 3 weeks, you're going to feel your body going through all sorts of changes. We scratched the surface in there earlier talking about the neurological balance in different realms of nervous system. Most patients are stuck in a sympathetic state of overdrive, fight or flight. We want to help shift them into a parasympathetic state, which allows their body to go through more rest and digest, the healing side of the nervous system. All the longevity studies show us that in order to live a long, happy, healthy life, you have to have balance between both systems. You can't just be set in one. The patients that are chronically fatigued or lethargic, they're maybe stuck in parasympathetic. They need some sympathetic activation. Those that are go, 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 their mind's always racing, fidgety, restless leg, they're stuck in more of a sympathetic. They need to calm down and the nervous system needs to slow down. So giving you the ability to adapt with the nervous system, no matter what stressors come into play, whether they're viral, whether they're physical, bacterial, mental stress, emotional stress, they're all stressors on the nervous system. Nervous system is what controls every system of the body, so we have to make sure that it has full ability to adapt and to function the way that it needs to.
So with the retracing, I found that interesting because I actually was doing a little research for today and was reading a little something that you had on your website, I think it was, about retracing. And it reminds me a lot of when, the nervous system aspect of it, but also the energetic part of that.
100%.
And it kind of allowing the energy to flow in a way that it hasn't in quite some time.
Yeah.
And when I look at the picture here, and I think about, all of the years that it took for it to get to that point, and then bringing it back into balance, it's almost like a pushing the reset button.
100%.
In a way.
You are, and you're going to the source to do so.
Yeah.
But what I wanted to finish was, if you've been out of alignment for 35 to 40 years, the body heals at a rate 12 to 1 when you are holding and maintaining alignment, which is why for us, the accuracy and the precision is so important because your body heals from holding your adjustment, holding your alignment. Mm-hmm. Okay, well, how do we get it to hold? Precise measurements and precise accuracy of controlling variables. So it's not a hand. How much pressure do I put on her? What exact angle? Oh, she needs 12.7. Okay, tell me when I'm there.
Right, yeah.
It's tough to be accountable. And yes, you could be a 20-year veteran and you're a good doc. I'm not saying you can't deliver those miracles. I'm more concerned with the frequency of being able to deliver those. And so the accuracy is what allows the patient to hold for 6 months to 2 years. Now you have expedited healing. When you're getting a hand adjustment, it might only last for 1 to 2 weeks, let's say. Realistically, it's more like 2 to 3 days, but let's be nice and say it lasts a week. Then you wait 3 or 4 days and you go back and you get the adjustment again. And then you're good for 4 days, you're healing, and then it falls out and you wait a week till your next appointment.
Yeah.
Over 90 days, you've maybe held for, let's call it 30, if we're being generous. When you hold one adjustment for 3 months, you have 90 full days of compounded healing. That exponential healing factor, it's through the roof because you're holding and maintaining the alignment. Nervous system is in a balanced state. Blood flow is optimized. The body's becoming efficient now with proper signaling. The goal comes from the accuracy, which is why we're so big about this as a starting point. It doesn't mean that for clients after, I still won't do traditional chiropractic. Next week, when you come back for your follow-up, it'll be the first time where we get to lay you down, check Atlas. As long as it's still holding and good to go, we flip you over, and now we scan the rest of the spine for secondary adjustments. You can absolutely expedite that healing time doing secondaries, but you do not heal solely from just being twisted and cracked over and over again.
Right.
This is the starting point. This is the order of operations. We set the stage here, let the nervous system balance. The body has a way smarter intelligence than any doctor, a room of doctors combined can have. Let the body do what it needs to do. We're just removing that interference at the source that controls it all. And
so would you recommend that people come in at specific stages of life, even if they're feeling great? Because I would imagine, I had some issues when I was younger, but nothing that I felt was
100%
out of the ordinary.
And here's the thing. If you would have came in at, let's say, call it 22, you would have maybe been dealing with dysfunction for 5 to 10 years. Mm-hmm. So it's a much quicker healing process. When we talk about that 12 to 1 ratio, well, there's 12 months in a year. If you've been out 8 years, well, you don't even need to be holding for, it's 8 months.
Right.
Versus if it's been 35 years, I'm looking at your healing journey to reverse this into like undo the damage that's been present, it's going to be a 2 to 3 year journey.
Right.
Does not mean it takes 2 to 3 years to feel better.
Right.
With this technology and the accuracy, after about 4 to 6 weeks, patients typically note like a 60 to 70% reduction in symptoms. So you're going to be feeling better here in the next month or so. With that said, that process of the retracing and the biorhythm every 4 to 6 weeks, you typically go through like a 3 to 5 day window where the body's just kind of remembering old injuries, working through old dysfunction, old injuries, old sites, old trauma, old damage, etc.
Well, and I think from an energetic perspective too, that also happens. You know, when you do some clearing, some energy work and some clearing, sometimes you have to kind of dig into some memories and traumas.
I've had patients on this table that directly after their correction, not 3 minutes later, they just talk, I'm sorry, I'm crying and I don't know why I'm crying, and they're just expunging.
Releasing, yeah.
We didn't even have a therapy session. I didn't say a word to her about any of her traumas.
Yeah.
But they're stored in the primitive areas of reflex, which is brainstem.
Yeah.
And so again, if there's dysfunction there, we have to clear that interference to allow the rest of it to want to do what it needs to do.
Well, and that makes me think about this working in tandem with the physical, the energetic, the mental, and the emotional.
We work with so many Reiki healers and energy healers that say it's just a nice catalyst for them. And what I always like to say when I'm at talks is this is not a supplement or you trade this for that and you don't do that. This is a foundational piece that boosts all the other things you are doing.
Right.
It's an enhancer, 100%. Yeah.
Yeah.
All right, let's move on to one of these next films here. This is the fun one where we had you have the mouth wide open. As you can see, it gets the teeth out of the way, and then I can see not only the atlas bone, but also how it sits on the second bone, C2. We're looking at measurements in like millimeters here, right? But with that kind of weight bearing at brainstem, it matters. You can see clearly here too, the space and the difference from this side here versus this side here. I mean, it's almost 50% difference, and I could probably pull that down even a little more. The atlas for you has shifted out to the left-hand side. Let me pull that up for you here. Now, the green line is the weight-bearing center line. The yellow line is where your anatomy has shifted off to. Your atlas is out to the left-hand side, 1.55 degrees. So if we see this here, it's a straight lateral shift. This is the front of the spine. This would be the back of the head. So this first bone here, atlas, has shifted over to that left-hand side. When that starts to happen, you see how it starts to clear and take away space where brainstem sits. This is foramen magnum here. And that's just talking about a lateral shifting that takes place. Next, for you, your atlas is actually rotated 2.13 degrees. So when we take that film and we know that you're perfectly neutral, our software determines what your perfect weight-bearing center is of your skull. And then when we measure the atlas, which is this ring-shaped bone that we see right here. Remember, you were looking up, and we shot down through the skull. So it gives me the ability to see that ring-shaped bone, which is sitting right here.
Yes.
Once I can measure all the structures on atlas, now we get a difference of what that misalignment is at the level of brainstem. So your atlas is actually shifted forward on the left-hand side, 2.13 degrees underneath the skull.
And so what does that, what sort of physical sensations would that elicit?
This right here would cause you to have less drainage on the left-hand side. So when we're talking about the glymphatic system, so everyone's familiar with lymphatic system. The glymphatic system is the waste and toxin removal from the brain. You have CSF fluid that is cleaning the head, removing all neurotoxins, all the metabolic waste. Its main drainage is through internal jugular vein while the patient's laying down. The internal jugular vein is this blue guy right here. So a patient might feel more chronic fatigue. They might feel pressure in the head or the neck. This definitely will cause TMJ type issues where you'll find just like the jaw or the ear is more full on one side of the body. Some patients will have like visual disturbances on only one side. Headaches, absolutely, from this kind of a forward misalignment.
Would you notice it on the left side because it's on that side, or would you notice it on the other? Or
you could. I typically find more like ear fullness and jaw pain and dysfunction on the side that the atlas is laterally shifted to.
Okay.
I've definitely had them where it could, there's a lot of variables. It could be any side. I would say as an average, the side that the atlas is shifted more laterally is the side where there maybe will have more ear fullness, more jaw pain, like TMJ clicking or just on one side.
Okay.
It's an overstimulation. It is still one side of the body. So whether it's the musculature that's attached in the jaw or whether it's in the low back, it still is an asymmetry or an imbalance between what's holding and maintaining the congruency of the spine.
Okay.
Makes sense?
Yeah.
The other thing that I want to bring to attention for you, because you are one of these 7 out of 10 people, you see this little horn-like bone that comes down right here?
Yes.
It's called a styloid process. The model depicts this bone as only being 1/4 of an inch long, but we've been data tracking it, and with Dr. Stan Pierce Jr., he kind of started this, and he was the first one to find this 5 or 6 years ago. What he's finding is that 7 out of 10 people, it's like 68% of individuals, they actually have elongated styloids down past the level of atlas.
What is that term?
And it doesn't mean that the bone itself is longer. That's an attachment site for something called the stylohyoid ligament.
Okay.
That ligament attaches to that bone there, and then it works down and it helps hold the hyoid bone in place.
Okay.
It's not that your bone has grown longer. It's that your stylohyoid ligament has become calcified.
Oh.
Through the strain in the neck and your neck trying to hold and maintain ever since you had that trauma 10, 20, 30 years ago, whichever one it would have been.
Yeah.
That's important to note because the orientation, you notice how it comes down under the skull, but it's directly in front of where the atlas is. Mm-hmm. If this bone has grown longer down here to the bottom of C2, like yours has, and then the atlas is shifted more laterally and then rotated forward, these actually sit on like the very edge of it. So you can start to see there's going to be a secondary level of compression that takes place because you're actually moving these structures forward into a bony wall that now runs down in front of it.
Oh, wow.
Does that make sense?
Yeah.
These individuals are more susceptible to headaches. These individuals are more susceptible to neurodegenerative diseases down the road like Parkinson's, Alzheimer's, MS, etc., because of the inability or the less space needed to allow those to drain out. I've done so many talks where we do it specifically on neurodegeneration. We look at the MRA studies, you look at the internal jugular vein thermal scans. You can literally see in the flow studies, the right one, clear as day, nice and thick as it should be. Left side, no flow. And it's just like, that's a problem. Your ability to drain the neurological waste, the toxins, the metabolic waste out of the head is 100% indicative of your brain health looking down the road. It's very similar to like a diabetic patient where their calves or ankles will get like kind of scaly, the tissue's deteriorating, and it's like very full of edema. It's the inability of the dirty blood to travel back up against gravity to then be recycled. So the tissue in that area where the dirty deoxygenated blood is pooling, the tissue starts to die off. Starts to get scaly, starts to get kind of like, not so good. It's no different up here in the brain, which is why the Parkinson's, the neurodegenerative diseases, these things start in the 30s and 40s, and then it's diagnosed at 70, 80 by the time it's been slowly deteriorating over time. And I'm not saying, I understand Alzheimer's, they're looking at it as like type 3 diabetes. Well, no, it's a sugar thing. Okay, MS, that's amyloid plaques. Okay, I'm saying it, regardless of what allowed or what protein is causing that degeneration, they all have the same issue where it's the inability to drain whatever's stuck up there. I don't care if it's amyloid plaques. I don't care if it's sugar proteins. I don't care what it is. It needs to have the ability to get out. So our ability to open that canal and allow for more optimized blood flow is helping keep the brain healthy itself. Make sense?
So doing the procedure today and refining the placement of everything here, that will, I mean, because you on that model, you showed me all of these different places where things have moved and shifted and there's not as much space.
Correct.
Is this creating that space so that everything will over time naturally kind of go back to where it's designed
Correct.
to be?
I'm going to shift the position of the atlas today, and as soon as we go back into that room, I'm going to retake x-rays on you after the correction's done, and I'm going to run it through the exact same software again so that we can see how much space was created.
Okay.
And we have our metrics for what our goals are and what we're typically aiming to reduce and whatnot. Also, this is a good segue here. This is a percussive sound wave, right? What that means is that you're not going to feel anything. It's not like a puff of air, but our sound waves carry mass. So I'm literally moving bones in your inner ear right now with the sound waves associated with what I'm saying. You don't feel me talking to you, but sound waves are causing those vibrations.
Sure.
This is measured at like 68 decibels and it's 2.5 kilowatts of power. But when this electromagnetic striker drops, it compresses that sound wave percussive energy. The sound wave itself is what's actually moving the atlas bone. So
Which is so cool.
We are physically moving a bone. The cool thing about this piece of equipment, and again, kudos to Dr. Stan Pierce Jr. that actually created this whole machine with him and his late wife, Dr. Kelsey. they were told that it was not possible to make a table that had the ability to pivot and move on all 3 axes. That's extremely important because our joints, we are triaxial beings, right? We rotate on the y-axis, we flex and extend on the x-axis, and then we laterally bend on the z-axis. There's 3 different axes that how our bones and joints move.
Didn't know that.
All the other upper cervical tables that emit sound waves, minus the Spinalite table, they're the other brand that has the 3 axes. They're all only 2 axes. That's a problem when you're trying to then do the math and have proper calibration for an individual patient, because they would get this great data, but only put it into a machine that has the ability to deliver it on 2 axes. This is one of 8 in the world that has the ability to deliver it on all 3 axes, but it is not like frequency sound healing from like bowls. You know, like those sound healing bowls.
Yeah, with a
This is like a legit percussive force that is going to be shifting that bone, but because the force is particular to just that level of atlas, we're not actually moving the atlas outside of normal ranges of motion. And that's crucial for individuals that have higher levels of arthritis, osteopenia, osteoporosis. There's no risk or ligament for a stroke or artery dissection, because trauma happens on those cases when you take a bone or joint outside normal ranges of motion. That's what causes a cavitation or a pop that you hear.
Right.
It's because you've taken that joint past in range and you've moved it outside of normal ranges of motion. You will not hear a crack or a pop. We are shifting the atlas in normal ranges of motion to protect the patient. No ligament laxity, no micro traumas. I've adjusted a 5-week-old baby on this table and a 96-year-old woman on this table that no one would touch. She had 2 spine fusions in her neck.
Oh, wow. Which one, the baby or the
lady? She was 96. She had 2 cervical spine fusions, one at C3, C4, one at C5, C6, something like that. Riddled with osteopenia. No chiros wanted to touch her. She had bad sciatica.
Oh, gosh.
That's one of our easiest fixes with this machine.
Okay.
So laid her on her side, did the math, did a sound wave. She's like, that's it.
Can you see the osteopenia and like that sort of thing on these scans or the x-rays that you do?
You would see different levels of arthritis or like eburnation on some of the photos. Yeah, like if we look at your cervical spine here, clean. Like this is different levels of arthritis that are right here, the bone spurs.
Yeah.
You don't have too much at all though in here, which again is a testament, because the patients that I see that do take care of their health and they're all doing the biohacking or they are eating right, the eating is the biggest thing, because it leads to inflammation, and inflammation is then what causes the problems.
Yeah.
People that are clean eaters, I have a vegan guy in here and he has the worst scoliosis I've ever seen.
Oh gosh.
He's 30 years old and I'm amazed that he's not in as much pain as he is, and he's fully vegan, eats clean as can be, grows all of his own fruit and vegetables naturally.
His body just needs something different, it sounds
100%,
like.
yeah. And he had a real bad trauma when he was 2 years old. It ran in his head into a table at the corner of like a table and a wall thing and jammed him up. When this is not right at that age and the body's developing, it just follows suit with what's up top.
Right.
There you go.
Right. Yeah, it's just amazing.
So what we're going to do is I'm going to program these numbers into this machine, and then we're going to get you corrected and then go take some post x-rays.
Okay.
Before I do that, I want to do a quick baseline again, and I just want to check legs, low back, arm before we do the correction.
Okay. One other question. So
Please.
when you do the adjustment, where are you trying to bring it to where would be like a normal, natural, balanced range, or is it?
So the goal, I get what you're saying. The goal is not getting it down to 0. We're going to shift that bone today, and we're going to get your body to a neurologically balanced state.
Okay.
Which is why the exam is so important prior to say, okay, when we're checking her right now, the left leg is short, her low back on the right side is a little more hypertonic, more spasmed, and her right arm is weak. Weird. She's righty, actually. That shouldn't be. There's nothing trauma there.
Right.
Turn your head, all of a sudden everything clears and it's strong. Well, we'll deliver the correction, and the goal is that when your head is neutral, legs are level, back spasms have dropped off, the arm is strong all of a sudden, because you're clearing the space to allow the nervous system to function properly. A lot of patients will come and they're like, well, doc, it's not at 0 yet. The goal is not 0.
Okay.
Some patients, and you're a great example of this, you have what's called a 1-degree cranial aberrancy, meaning that the skull bone underneath these 2 skull bones right here, they're called condyles, that's what sits on the atlas.
Okay.
They have developed asymmetrically in accordance to the side of the skull of your head. So it changes the weight-bearing component. You're shifted actually 1.55 left, but we take your genetics into account. So we're only actually adjusting you at 0.55. What that means is we're we're making sure that the correction is to your genetic specifics. Epigenetics is the correct term, but so that we're making sure that it's actually calibrated to you for the correction.
Okay.
So the goal is reduction. We typically see an average of 40 to 60%.
Okay.
We don't know how much of that is left in there is genetics or that's the way the body is. As long as your body is in a neurologically balanced state, patients start healing.
And so there, like, if a follow-up treatment is needed, it's because maybe something has shifted, not because you're trying to attain a higher...
Correct.
Okay.
A higher level of clearance or whatnot.
Right.
No, 100%. If you come back in here, let's say 2 months from now, and you're like, Dan, I was getting into the car and I bumped my head when I was getting into the car and I've been doing really good for the last 2 months, but I'm just kind of feeling weird these last 4 days. It's a sign that like we might have knocked the atlas out. I had a lady that went on a roller coaster with her nephew. She's been great for 9 months. Doc, I haven't seen you in a while, but like something's off. I just got back from Disney and like I'm not okay. Life's going to happen, which is why we treat it like a pseudo dentist office where it's like, hey, once we get you stable, check in once a quarter.
Yeah.
I have some that say, you know what? No, I'm retired. I have the money, the time. I want to invest in my health. I'm going to see you once a month for the next year and I'm just going to keep up with it. Perfect. The patient kind of dictates the treatment plan in accordance with us. If I see someone who's very degenerative, we are going to need maybe more adjustments and more time. If I see someone who just had a bad fall 10 years ago and they are otherwise pretty healthy and good, if they just have bad headaches and vertigo, we do the sound wave and then that's gone after 2 weeks. Yeah, I'll still keep an eye on them for 2 to 3 weeks to ensure things are stable and good. Once we've spent 4 to 5 weeks together and I know you're stable and symptoms are gone, go have fun, live your life. Check in with me in a month. We'll make sure it's still stable. If you're still stable, then I'll see you in 3 months. Perfect. That patient only needed 3-4 visits. Cool.
Right.
It's no need to 32 visits, 6 months. You have to lock in with me. I've heard so many different things from all different individuals.
Well, and I think that's what people really appreciate is the fact that you're not selling if you don't need it.
No.
You're checking to see, are you a candidate or not?
Yep.
And you're allowing the patient to take some autonomy over their health and well-being with some guidance.
Yep. And I want them to have that ownership. We're going to give you the tools. We're going to build you a customized rehab plan that you're going to be able to do at home. We don't charge extra for it. It's part of the care and that's what you need when you're in here for one of those visits. You use us as a guide as you keep healing and moving forward. We'll give them some of the neck curve tools and I'll talk to you about that next week.
Okay.
We can start doing some things that will allow you to put like a fulcrum, if you will, in the middle of the neck here. So as you lay on it, it does help that head want to fall back to help at least, if minimum, stop any further progression.
Okay.
This is something that always seems to shock people, but we are in a head flexed position for 4 to 6 hours of the day. For tall people, it's worse because you're talking down at people.
Yes.
But whether it's phones, typing, laptops, reading a book, you're like this a lot. It's very rare to find someone that has a profession where they're like this more. Mm-hmm. So the ergonomics take play in it. If minimum, we can stop or slow down this progression by putting you in an extended position with gravity helping for 30 to 40 minutes a day. It's going to go leaps and bounds better for the preservation of these discs because there is already a loss of disc height there.
Yeah.
There is degenerative changes that are there. We do have to start making sure that we're opening this space up. And as you come back and we work through some of those secondary visits, we'll assess that region and we'll check. But step one, we have to set the stage by allowing Atlas to be back in its proper position.
And would that area have an impact on like maybe the shifting of like that? I don't know what that would be, like this bone right here in the...
Yeah, so that's T1 right there.
Yeah. So that there is a correlation. There's like
T1 is the bottom of that stack here. Yeah. So depending on what's happening here, it could cause compensations here or vice versa.
Okay.
100%.
So working on that cervical part of the neck could essentially shift the T1 in time or
to a better, more biomechanically favorable position. Absolutely.
Okay.
Has the potential to. Yeah.
Okay. Interesting.
So here's what we're going to do. I'm going to have you lay on your side. We are going to get a quick baseline on your back here and ankles just hanging off the edge.
Okay. Do I shoes
You can keep the shoes on for this. Yeah, it makes it easier to measure. And then just scoot down a little bit further. That way the ankles are just hanging off the edge. Yep, a little more.
A little more.
Right there. Perfect. I got the pillow for you. Come on down.
Okay.
We're just going to check the leg length real quick. And yours is left leg, measuring about 1/4 of an inch shorter than the right. I'm going to check your low back. Put your hands on your chest for me.
Okay.
Yeah, so very clear. Your left is nice and relaxed. The right is not at all.
Not at all.
Put your left arm straight up in the air for me. And straight forward here. Good. Turn. I'm going to press down. Hold strong. Good. Right arm, same thing.
Put this one down, correct?
Yep.
Okay.
Hold strong. Interesting. So
Not as strong.
not as strong. You righty or lefty?
I'm righty.
You're righty. Okay.
Yeah.
So real quick, take your head and look to the left. Put the weak arm back up. Hold strong. See how you're neural lock and you're like fighting me and I'm really pushing now?
Yeah.
You're very strong when your head is left. So keep your head left. You can put your arm down.
Okay.
When your head is left, your legs are dead even, which means, let me check your low back, put your hands on your chest and keep your head looking left. Yep. Feel how those just turn off.
Mm-hmm.
So the goal is after this correction, when your head is neutral and I redo all that, your arm is going to be strong without your head needing to be turned. Back spasms will start to drop off. They will continue over the next 6 to 12 hours as the muscles start to release, but it will happen instantly. And the legs will level.
Nice.
Let me help you up.
All right.
Alrighty, what we're gonna do here, I need you to review this real quick. This is just a general informed consent. It says that we did do chiropractic evaluation and take chiropractic films. We're gonna read this one together and then I'll let you read the rest on your own. Rare but possible risks associated with some chiropractic treatments that may include muscle soreness. We've already talked about it. I'm expecting it. Muscles that are tight have to loosen. Loose ones have to tighten. There will be some remolding and rebalancing. The discomfort that people will typically feel is at its peak within 3 to 5 days.
Okay.
And then it subsides and then the body starts to feel good and then you just kind of maybe feel changes through the rest of the body. But you're going to notice the most of the stiffness and tightness here around the neck. I don't want you trying to massage it, pop it, twist it. Let it be. You'll come back in a few days or next week early on and we'll do your follow-up and we'll keep track of it as we continue moving forward.
All right.
It goes on to talk about musculoskeletal sprain, strain, or fracture. Absolutely not in my clinic because we do not do any sort of high force or rotary neck manipulations, neither of which are performed in this clinic. Please breeze through this. I got to leave you alone for a minute to read. When you're ready, give me a signature on the dotted line on the back.
Okay.
Thank you. As soon as I'm done with this, I'm going to give you your post-corrective instructions on how to best maintain this and protect it over the next few days.
Okay.
I am going to be putting you in a soft cervical collar that you're going to wear for the next 3 hours.
Oh, okay.
You do this to help stabilize the muscles in the neck and the atlas, but it also keeps you like consciously aware. And because the height of the collar is supporting your head and neck, the muscles don't have to work as hard.
Okay.
We're shifting the bone right away, but those sensors in the neck, I want them to reset and learn the new position that we just shifted atlas into.
Okay.
So you'll wear that for 3 hours after the correction.
Okay.
I will not have you doing any kind of like heavy or strenuous lifting or exercising over the next 3 to 5 days. I don't want you like running. I don't want you lifting weights. You can go on a walk tonight. You could ride a bike. You could get into a pool or a sauna or a hot tub. All those things are fine. Think like spa. Don't think like hitting the gym or doing CrossFit.
Yeah.
But you could go on a Stairmaster or you could go on an incline treadmill. You could do those type of light stuff and you could do that tonight, tomorrow. I have no problem.
Okay.
No lifting heavy weights overhead. Don't put a squat bar on your back. Don't be in the garage or in the garden like doing weird angles. Like be conscious and be aware that you just received like a procedure for your neck.
Okay.
This is not your normal pop twist, go off to play and have fun. I'll see you in 2 days. I want the neck to have the ability to stabilize.
Okay. Gotcha.
Now, how we're going to preset to do this correction, I'd like you to scoot your butt right here.
Okay.
Sit up nice and straight, good posture, looking straight forward. Go to your left just a hair, like 2 inches. Scoot your whole body 2 inches. Yep, perfect. Okay. Now, you're going to stay stacked on this arm. So as you lay on your side, this arm will be stacked here. And then this bone right here, the mastoid bone, is going to be resting on this headpiece. Okay. When we lay on our side, you just bring your legs up like you're laying in bed.
Okay. Baby, we're moving.
Fall down here. Good. Now bring your feet up for me. Good. I'm going to raise this up just a little bit higher. Very good. Let me reset this position here now.
Okay.
Scoot down just a little bit. Right there. Okay. Good. I want that head just to extend and relax over. Very good. Just like that. I'm going to move your hair right behind us here.
Okay.
This left shoulder, I'm going to have you shrug it up just a little bit. Good. And then the right shoulder, you're going to have the table feel like it's tractioning you down. That is perfect what I want. Good. C2 is going to the right. C2, perfect. Keep your shoulders just as they are. Your shoulders are going to rotate underneath you now. But the head stays pinned neutral. Good. Let's recheck this position real quick. Head up. Then let that fall over. Very good. The laser is perfect. Now the software is assuming that you are laying at 0 degrees, but you are not. 7.5.
Is that a special level or is that a...
Just a basic construction like inclinometer that gives me the level of what your head angle is actually at.
Interesting.
9.15. So now we set the table in. You can see in the digital readout down here, Misha, this is where we're going to be programming her numbers to get that Z axis right to where it says 9.1. Perfect. 2.13 anterior, so we make sure this is coming from the front. This is the y-axis component. 2.2, 2.1, good. Now, you zoom in. You hold still right there. Jaw, Atlas, there she is. Again, you're not going to feel anything. You're just going to hear a click.
Okay. So I just stay relaxed.
You just do nothing. You got it. We got you. Hold still right there. Very good. That was a correction.
Wow.
Still.
Yeah, I felt absolutely nothing.
Yep. Use your left arm here to help leverage yourself up. I'm going to help you sit up.
Okay.
And I just want you to keep that neck neutral, looking straight forward. Don't rotate the neck at all. Some patients will say they feel maybe a little bit of a lightheadedness or they feel a little bit of a, like warmth in the neck. I personally didn't feel anything when I got my first correction. Some patients tell me they feel nothing. Spin your whole body to the left, ankles hanging off the edge again.
Okay.
And we're going to recheck the same way we just did. Go ahead and lay on your back. Scoot down a little bit further for me. Right there. Good.
So if somebody had an issue on the right side, you obviously would turn them the other direction and you would address it on that side?
Correct. So it is just based on the measurement, not based on what arm is weak or what's hurting on them symptom-wise, strictly based on the measurement.
Okay.
The way that your angles have shifted, your atlas was laterally displaced on the left. So if I lay you on the right, we have gravity assisting us while we use the tool to put it back to a midline.
Okay.
Your legs are dead even. Put your hands on your chest. I'm going to feel your low back. Hold strong.
We'll do it in a bit.
Yeah, that's literally making me pop. You're strong. That's good. Let me help you out.
That's hilarious.
Good. Keep that neck neutral. Spin to your right for me. I'm like, man, that guy sounds like my dad. Head down. Very good. All right, we're going to go in the x-ray room and we're going to take 2 quick x-rays. What I want you to do is keep your neck neutral. Okay. I don't want you looking left or right. If you're going to look left or right, do it with your torso. You got it.
Okay.
So we can leave all this here. All right, so same thing. Scoot in a little bit closer. Good. Go ahead and look up. Good. And bend forward at the waist. Stop right there real quick. Okay, go ahead and finish. Letting that chin extend down. Good. Good. Hold still right there. Good. Really good. Hold still right there.
Mm-hmm.
Very good. You can relax. Sit up normal for me. Keep that neck neutral. You can go ahead and turn around and face the x-ray machine for me. I'm going to straighten this board out for us. And then you can slowly slide back in the wheels here. Keep coming, keep coming, keep coming. Right there, good. Put this back to 18.4.
I was just in the middle of recording. No, it's all good. So.
Very good. All right, you just stayed just as you are.
Okay.
Very good. Watch your eyes, lasers are coming on. Take the rotation out and hold still right there. Hold. All right, you just hold still for a moment.
All right.
Very good. All right, you can go ahead and stand up.
Okay.
I'm going to take this off and we're going to go back into the sound wave room. Gotcha. Right. Good. All right, let's go back to the sound wave room here. Clock or so, you can take it off. With that said, if you accidentally look left or right, you are not going to mess this up.
Okay.
Okay. I have people that drive from Naples, from Vero, and like they get their correction and they have a 2.5-hour drive home. Please, safety first. I'm sure he's driving, but if you accidentally look left or right at him, you will not mess this up. I want to limit the amount of stimulus that's coming into that region to let the muscles that are supporting it learn the new position, but you will not mess it up if you look left or right.
Okay.
So don't call me later and say, Doc, I looked left and like, no, you're okay. Just trust the process. Let it be. In here is a little bougie bag for you. It does have our post-corrective instructions. So wear the collars for the next 3 hours. Do your best not to turn your head for the next 3 hours. This one, especially for ladies that have a lot of hair, I don't want you tilting the head back excessively for 3 days. If you look up a little bit for something, not a problem. Mm-hmm. If you were to be washing your hair and you're someone who does it like this and washes it behind you, I want you to avoid that the next 3 to 5 days.
Okay.
Excessive extension is a vulnerable position for the atlas bone, especially when we first make those corrections.
Okay.
So just be mindful of it about the next 3 days. That's kind of the magic number when atlas is then holding and things are good.
Okay.
Do your best not to sleep on your stomach. Side or back is ideal.
Okay.
And I just want you to be mindful of something. If I'm sleeping on the bed here, if I'm a back sleeper, there's not a lot of distance between my head and the bed. So you need a thinner pillow to maintain your neck in a neutral position.
Okay.
If you're a side sleeper, there's a lot more distance between head and shoulder. You need a thicker pillow.
Okay.
I'm not a big fan of like saying go buy this pillow or selling them in the clinic because I think it's a racket and pillows are one of those things that's like custom to everyone. With that said, a neutral cervical spine is always a good idea. So just be mindful, if you are a side sleeper, you need more stack to keep the neutrality. If you're a back sleeper, you need a smaller pillow so it's not pushing the neck forward, going against our goals of the curve.
Gotcha.
See what I'm saying?
Yeah.
It goes on to say no reaching overhead. You can do your hair. You can take your shirt off. I don't want you lifting or straining heavy items overhead.
Okay.
And then no carrying heavy items. So that's like kind of the weightlifting, the strenuous component of it. I don't want you doing anything like that. Just let the body chill and relax. Today's Wednesday, so Wednesday, Thursday, Friday, Saturday, basically like Sunday, but Monday more or less is like when you can get back to your normal gym exercise routine, whatever you like to do. Your restrictions will have been lifted by then.
Okay.
I'll probably see you next week depending on your guys' availability, maybe Monday or Tuesday depending on the time for a follow-up. I'll give your body a few days to let it reset, so by the next time I see you, we can do a little bit of work.
Okay.
Don't carry a purse or a bag only on one shoulder. Try to have like it symmetrically balanced. So you don't just have one shoulder loaded up, or like one super heavy purse that's just like on one side. Just be mindful of the weight that you put on yourself.
Okay.
Most importantly, no rubbing, massaging, twisting, or cracking of the neck.
Okay.
Leave it alone. You're going to feel stiff and sore. You're going to feel like things are changing. I don't mind if you're just rubbing in here in like traps, lower neck. That's fine. I don't want you doing any rubbing in the middle of the neck or in the upper part of the neck.
Okay.
No hypervolt massage guns on the neck. It's too much percussive force. It will knock things out of alignment. There is a heat or an ice pack in here that you can use, so pop that in the freezer. If you have any tender or sore spots, throw some ice or some heat on it.
Okay.
I say discomfort the first few days. I say that very lightly. Some people, they experience where it's like pain and discomfort. Most of my individuals that are healthy and we're just like doing a standard procedure, standard correction, you're going to feel soreness as if you like got a massage or like if you got a physical adjustment.
Yeah.
That's the kind of sensation you're going to feel.
Okay. Well, I'm noticing already, like I feel tightness here in my jaw.
Yeah.
Which means like there's something that's
Something's
100%.
And TMJ is that's my tell for me. If my atlas is out, my jaw starts clicking. When I get my atlas put back in, jaw's good to go.
Okay.
So it's a sign for me, for sure.
One other question about this too is the that crunchiness or the crackly sound that can happen in the neck. Is that something that is related to it being out?
Part of it is arthritis. Part of it is malposition of the bones.
Okay.
So what we will talk about next week are some of the different aids, if you will, that we like to use with patients. Specifically, one that we like to use is called OPC3. It's a supplement, but it's more like a nutraceutical.
Okay.
It's not a pill or a capsule. Just for like fun sidebar, if you're ever taking a pill or a capsule for a supplement, you're only getting about 30 to 40% bioavailability because the binders, the fillers, and more importantly, when you put that in your stomach, digestion, acid. So we carry an isotonic brand that is, isotonic legit means same fluid pressure. So it's the same fluid pressure as the cells, the same ionic weight, the same pH. It's a powder you mix with water. When you drink it, the stomach goes, oh, hey, that's already been digested. There's no need for any acid. Pyloric valve opens up within the first 10 minutes. You're getting about 92% absorption of that. So it's just as a way quicker, better way to get any kind of a supplement into the bloodstream. Also, the OPC supplement that we use that I was telling you is like an aid that most patients are on the first month through their detox.
Okay. It's
grapeseed extract, red wine extract, bilberry, resveratrol, and pycnogenols. But it's like 5 of the strongest antioxidants. Specifically, they add synovial fluid back into the joints, so it's like a lubricator. So a lot of that crepitus sometimes will come from it being dried out or inflammation. It just helps rehydrate the joints, but it also is a free radical scavenger. So while your body's detoxing and purging this, it's helping aid and go through. I always say the same way we make such positive change by moving a bone off of a blood vessel to like allow for better flow, this product goes inside and it cleans up the inside of the blood vessel so that there's no atherosclerosis in there, no other weird clots. It helps heal the damaged blood cells.
Okay.
We'll talk about that again next week.
That's pretty cool.
But it's you're targeting the same problem 2 different ways, one externally, one internally.
Which I love, that tandem approach,
100%.
looking at it, supporting it from different perspectives.
Well, and we joked too. I had a military guy in here the other day, and I was in the Army, and so we're like, I don't really care like which one we say did it. It's the fact that we're not going to let the enemy escape. We're just going to hit it from every direction, and so like it's solved. So
surround it, take it.
That's like the military idea of it.
That's hilarious.
This is for you.
Okay.
Do you have any last questions for me before I get you out of here and then we transition over and go over his exam?
I don't think so. I'm sure I will, though. And I had other questions that I wanted to go over, but maybe we'll do that next.
Well, and so here's what's going to happen the next time. The next time you come back here, regardless of his treatment, but for you, what we're going to be doing is reviewing the pre and post x-rays. So I'm going to go study those later this evening. I'll run it through the software. When we meet next time, the first thing we'll do, pull up your pre-x-rays, pull up the post x-rays.
Okay.
We'll look at the visible changes. You can have the camera then. That's also typically where a lot of patients will ask like more follow-up type questions in our follow-up.
Okay.
And then as soon as we look at the positive changes in the numbers, then we go and I have you back on the table and I redo this same exam again.
Okay.
Legs should still be level. back should still be nice and relaxed. That arm should still be wicked strong like it was.
Yeah.
And the nerve that I'm feeling for in the neck should not be inflamed the same way it was not anymore right now.
Okay.
So I know via just what I checked your body prior and when I checked after, we've made neurological change.
For sure.
Now I want to confirm it in the films, objectively measuring, not just, oh yeah, she feels good. Feelings are 10% of the nervous system. If a doctor is only treating you based on the 10% of how you feel, that's a problem.
Yeah. They're missing
We
a
have
lot.
to have neurological indicators and metrics along the way to be able to monitor. All right, so we're going to be going over your pre and post films. These pre-films are the ones we took last week, is where we gathered all that data to be able to give you the correction in the sound wave table. I always like to preface, the goal is not getting these numbers to 0.00. We don't know how much of this is anatomy. The goal is getting you to a neurologically balanced state on the table. With that said, these numbers should reduce. We typically see an average of about 30 to 60% reduction in those numbers,
Okay.
obviously closer to zero. The idea behind that is the closer to zero, the more space we're creating in that foramen magnum where brainstem and atlas is at,
Okay.
which is what allows the body to be able to communicate properly. Before, when we checked you, a leg was short, one side of the back was more spasmed, one arm was weak, nerve was swollen. As soon as we were done with the correction, legs were level, back was balancing out, arm was strong, nerve was clear.
Yep.
It's now been a week later. I want to ensure that when we check you today, we have those same exact findings. Legs are clear, back is balanced, arm is strong, nerve is clear. That tells me that, hey, she still is holding and maintaining the adjustment we delivered last week, and we could objectively measure that here in the post films.
Okay.
So for you, your atlas was out to the left-hand side, 0.55 degrees. You are now out to the left, 0.03.
Wow.
Is a major reduction and closer in like the 90 percentiles. When we go here to look at the lower neck angle, which is the difference or the discrepancy between the weight-bearing green center line and the yellow line here from C7 up to Atlas, that number is FAS, measured at 6.06. Your new FAS in measurement here is only 3.65. Awesome. It's about a 50% reduction there.
Right.
Your atlas rotation, that was one that was a little bit more of a metric for you here. So your atlas was rotated left and anterior 2.13 degrees. That cut all the way down to 0.13.
Wow.
So again, 90, 88, 91 percentile right there.
Mm-hmm.
And the final measurement was that C2 vertebrae, so the second vertebrae that Atlas sits on top of. FAX is the measurement of that C2 rotation. It was measured at 7.51 degrees rotated, and it's now being measured at 1.25.
Wow.
So a great reduction overall. Honestly, when I see patients that are on the higher end of that 30 to 60% threshold, this means two things. One, we didn't miss, which is a good thing.
Right, right.
Two is that your body does have the ability to heal. There still is enough synovial fluid in there that's allowing those joints to slide. They're not arthritically bound to where they cannot move. This is a good reduction, which also the more change we see typically equates to the patient feeling more changes and more of those healing type effects.
Okay. So which would make sense with all that I was experiencing.
100%, yeah, which is very normal. It's par for the course. And I'll tell you, the toughest part of my job is the first 2 to 3 weeks of a patient being under care. Because it's them doing that up and down roller coaster and feeling like, man, I have more things now than I did before.
Yeah.
It's
like, what the heck did I do?
It's the body going through changes and healing from the 20 years of dysfunction. And so if you remember, and we look back at your initial films here, it takes 15 to 20 years to lose this curve. It takes 10 years to lose the health of the disc. It takes another 10 years to start developing these bone spurs and osteophytes. You've been out of alignment and your body has been compensating for close to 35 years.
Yeah.
It's going to be a little bit of a healing process, and I don't anticipate it being solved in a week, but I do anticipate you feeling the changes and working towards a positive trend line. And what I tell most patients and what they report back to me is over the course of that first 4 to 6 weeks, they see a reduction of about 30 to 60% in symptoms that drop off. And you should notice that the severity and the frequency become less and less. Not that it's a magical sound wave and it just heals anyone. It's restoring that natural balance and foundation that gives your body the natural ability to heal and work through, because you're no longer compensating.
Well, and I think that's the key, right? Is empowering people, setting their body up for success so that it can do what it innately and naturally.
We never wanted to be an office that required people to come 3 times a week. You're locked in for 32 visits for 6 months.
Yeah.
I don't know what the patient's going to need, and we're going to see how their body responds. Some clients, they have 1 sound wave and 2 or 3 daily visits, and after about 3 weeks, they're great.
Right.
Some clients have had more degeneration, and we see them for 8 to 12 visits over a span of 4 to 5 months. We want to give them the tools, build them the plans, use us as a guide. They should not need us for them to be able to heal.
Right. And I love that. It's a kind of a co-creative process, co-partners in that.
100%. And they have to have the responsibility and the ownership, because I can only do so much in the 20, 30 minutes I'm going to spend with them once every 2 weeks.
Right.
There has to be some ownership on their end to be able to make sure that they are moving forward. With that said, you hit it perfectly. The body has to be set up for success, and it's our job to create the environment that lets their body thrive.
Yeah. Perfect. All right.
Let's get you checked here on the table.
Okay.
They're going to have you lay on your back, ankles hanging off the edge of the table. Good.
Okay.
Yeah. Perfect. Put both feet on the table real quick, and I just want you to do a quick glute bridge for me and clear the pelvis. So scoot down a little bit more.
Oh, here?
And then now bring the feet on the table here. Bend, bend, bend.
Oh, I see what you're saying.
And then
like
glute
this.
bridge. There you go.
Okay.
Back down, and then ankles hanging off the edge.
Gotcha.
Perfect. Love it. Legs are dead even. Put your hands on your chest. If the legs are level, it means the paraspinal musculature also needs to be balanced. So your paraspinals are balanced, but I'm feeling a lumbar vertebrae right there that's not too happy.
Yeah. That was what I was feeling before.
We're going to check that today on the secondary. So far, Atlas is very clear. Paraspinals are very balanced. Legs are both dead even.
Great.
Put your left arm straight up in the air for me.
Okay.
Perfect. You're going to hold strong. Hold. Very good. Right arm, same thing for me. Hold. Yeah, they're both very strong equally.
Which they weren't before.
No, they were not. Let me help you up.
Okay.
Go ahead and spin to your right for me. Just face this way. I'm going to come behind you and check that nerve in your neck.
Okay.
This is that C2 dorsal root ganglia. It's one of the nerves that comes out between Atlas and C2. We're going to check this. Last time it was inflamed. After the correction, it was not. I want to ensure that it still is not inflamed. Your Atlas could not be more clear.
So what are you feeling for when you do this?
I'm feeling for like a little BB. I'm feeling for a pocket of inflammation or a nerve bundle that is sticking out swollen.
Okay.
I can feel that the muscle right here is tight, and I feel that we can do some manual therapy on it, working through that. What I'm feeling for is that nerve root
Okay.
that would be inflamed if Atlas was out, which yours is not.
Great. Awesome.
Hold the Atlas like a champ. So at this point, this is when I would take the client back to the functional room, and I would say, okay, let's take a look at that lumbar vertebrae.
Okay.
Let's take a look at some of the muscles on the side of the neck. Let's take a look at the upper thoracics and release those to take some pressure off of the neck and some of that tightness that you were feeling here.
Okay.
Atlas is holding good. Now that the frame is balanced, now we go ahead and we get to start our work. But we're not fighting your body as an uphill battle. If you don't turn off those neurological spasms and I go to make that adjustment, no wonder it doesn't stay. The spasm just pulls it right back out. The contraction pulls it back out. Your body is neurologically clear. Now we can start going to work and we can go ahead and that expedites that healing process.
So all of the areas where they kind of lit up today, besides that.
Old areas of dysfunction, areas of compensatory patterns, your compensations for how you've been living.
So they're basically like, okay, let's go, let's get healed. And then that the energy is able to flow through the body in a more efficient way now that this is clear.
You got it.
Got it. Okay. Cool. So I think that's pretty much the whole kit and caboodle
You got it.
Of the process. So Dan, thank you so much.
Thank you. I appreciate it.
Sharing your story and your wisdom and your work. It definitely is making a change in people's lives. I know it. I'm excited for my continued healing journey.
Absolutely.
I know that we will have further conversations and connections for sure.
Yes.
And we thank you, the viewer, for being with us today. We really appreciate it. If anyone wants to come and check out the clinic, how can they find you?
Yes, www.atlasclinics.com. We're also on Facebook and Instagram at Atlas Clinics Pompano.
Awesome. All right, everyone. Remember, we learn from one another. So please do share this episode with someone that you think may benefit and pop on in and say hi to Dr. Dan. Thanks for watching. Ciao for now.